This interview focused on Gordon's sleep rest pattern is a role-play assignment reflecting a collection of fictitious names and data. Good morning, I'm Nurse Johnson.
Hi, I'm Patty.
Hi Patty, nice to meet you. Can you tell me your last name and date of birth, please?
My last name is Smith and my date of birth is March 22nd, 1995.
Thank you. What brings you in today, Patty?
I've been having some trouble falling asleep and staying asleep, and because of this, I'm tired all day long.
Okay, I will conduct an interview to get some more information about your sleep problem. And this interview and all the information that you give me will be totally confidential and will only be shared with the healthcare staff that needs it to treat you.
Okay.
Do you have any questions before we begin?
No, I don't think so.
If you have any questions throughout the interview, please do not hesitate to ask, okay?
Okay.
So, Patty, are you currently taking any medications for anything?
No, I don't take any prescriptions, just over-the-counter medications when needed.
Okay, what is your occupation?
I'm a full-time college student and I have a part-time job.
On average, how much homework and studying do you complete in a day?
I usually have about 5 hours of classes, and then I do homework and study for around 8 hours a day, sometimes more, sometimes less.
So on a typical day, you spend around 13 hours dedicated to school?
That's correct.
Let's get back to why you're here today. When did your fatigue begin?
Around the middle of August, so about 2 months ago.
Okay, does your fatigue occur on a daily basis?
Yeah, I can't get through the day without at least 3 cups of coffee, and I often take naps to try to make it a little better.
How often do you take these naps?
About every other day.
And about what time do you take the naps and what is the duration of them?
I have class until 6, so I usually will sleep right after that till about 9, and then have some caffeine and start my homework.
So you take a nap at 6 p.m. and have caffeine around 9 p.m.?
Yeah, probably about 4 days out of the week.
Around what time do you usually try to go to bed for the night?
I get into bed around 2, but I usually don't fall asleep for an hour or 2 later.
What is the reason that you don't fall asleep right away? Can you elaborate on that for me?
Sure. Well, my roommate comes in late at night, and sometimes she's with friends, but even when she's alone, I can't sleep when she's getting ready for bed. I usually talk to her for a while or go on my phone and catch up on social media. So that usually makes me lose track of time, and before I know it, it's like 4 a.m.
And what time do you wake up?
Well, my first class is at 10, but sometimes I miss it to try to sleep in a little.
Do you wake up frequently during the night?
Sometimes, yeah.
And when you wake up in the middle of the night, how long does it take for you to fall back asleep?
Maybe an hour and a half or so.
So you get around 6 hours of sleep a night?
On a good night, yeah.
And how do you feel after those 6 hours of sleep? Do you need to go to the coffee shop before class every day?
Yes, I go to the coffee shop every morning before class, and even then I'm still exhausted. I find it hard to stay awake during my classes.
So you get 6 hours of sleep maximum, miss class sometimes due to sleeping in, and drink caffeine multiple times a day. Is this correct?
Yep, that's right.
Is there any other supplements that you take to help you stay awake or help you fall asleep at night?
To stay awake, I drink soda sometimes. My friend had recommended caffeine pills, but I've never taken those. I used to take Advil PM every night, but my mom told me I shouldn't become dependent on that, so I stopped, and it didn't work very well anyways. I've also tried to take melatonin supplements with no luck either.
So you tried melatonin and Advil PM to fall asleep, right?
Yeah, but like I said, they really didn't help at all.
Okay, how would you rate the quality of your sleep?
Not very good. Even when I do sleep for 6 hours, I feel as though it's only been a couple minutes.
So you do not get very good quality sleep. Do you have any dreams that you can remember?
Yeah, sometimes, but they're usually nightmares.
Do you have any numbness in your distal limbs, that is your hands, feet, fingers, or toes?
No, I haven't experienced anything like that.
Do you have any headaches at all throughout the day?
Yeah, especially after nights when I don't get a lot of sleep.
Okay. Do you take anything to help you with the headaches?
Sometimes I take ibuprofen, but usually all the caffeine I drink helps take it away.
Do you have any tremors or shaking that you've noticed?
No, sometimes I get jittery after a couple cups of coffee, but I wouldn't describe them as tremors.
Good. Have you had any fainting, dizziness, spells, or weakness?
No, I haven't had anything like that.
What about history of epilepsy or seizures?
Febrile seizure as a baby, but nothing recently.
Do you have difficulty with speech or swallowing?
No.
Have you ever had any head injuries?
I got a concussion in soccer once, but that was like 5 years ago. It was way before this problem started.
Okay. Have you had any blurred vision out of the ordinary?
Nope, haven't had any of that either.
Good. So based on your responses, I don't think your problem has to do with your nervous system, which is good. I'm going to ask you now about your gastrointestinal system to see if that could have any effect.
I've heard of that system, but I really don't have any idea what that means. What's gastrointestinal?
It means your stomach, intestines, and everything in your gut.
Okay.
Have you had any indigestion or heartburn?
I had heartburn when I eat food with a lot of acid.
Okay, what about nausea or vomiting?
No.
How often do you have a bowel movement?
Once a day.
Okay, good. That system seems normal. I'll now ask you questions specific to your arteries, capillaries, and veins. Did you notice any changes in your skin color recently?
Not really. My face is kind of red lately. A little more than usual.
Okay. When did you notice your face was more red than usual?
Probably about a couple weeks ago.
Okay, have you noticed any changes in temperature of your body?
No, it's warm for the most part.
Do you have a family history of elevated blood pressure?
I know my mom has high blood pressure.
Do you smoke?
No, I haven't smoked.
Okay, based on your answers to these questions, I don't believe your sleep-rest problem has anything to do with your peripheral vascular system. Now I'll ask you questions that are specific to the health of your heart.
Alright.
Do you have any chest pain, tightness, or discomfort?
Nope, I don't have any of that in my chest.
Okay. Do you have difficult or labored breathing when walking up the stairs, talking, or just walking?
I get tired walking up the stairs to my dorm, but I live on the 4th floor.
Wow, that sounds exhausting. How many times a day do you walk up the stairs to your dorm room?
Probably about 3 times a day.
Okay, that's a lot of stairs for one day, which must explain some of your fatigue. Do you have a history of heart attacks or strokes in your family?
Not as far as I know.
Okay, from the answers you have provided, I don't find anything abnormal about your heart. Now I'll ask you some questions related to your endocrine system to see if that may be the problem, alright?
Okay, ask away.
First off, do you have any history of diabetes or diabetic symptoms?
I've never had diabetes. What do you mean by diabetic symptoms?
To clarify, diabetic symptoms include urinating in large volumes or experiencing abnormally great thirst and hunger.
I haven't experienced either of those. My appetite's pretty normal.
Okay, do you have a history of thyroid disease in your family?
Not that I know of.
Okay. Have there been any irregularities with your menstrual cycle?
Nope, it's always right on schedule.
Okay. Good. When was the first day of your last period?
Probably around the 5th of this month.
Okay. Do you have any intolerance to heat or cold?
No, not really.
Have you experienced any excessive sweating?
Well, sometimes lugging my heavy backpack around campus causes me to sweat, especially when I'm in a hurry to get to class. I feel like my underarms are always soaked.
Well, underarm sweat is fairly expected with the amount of physical activity that you're doing while running around campus.
I suppose.
Have you experienced any weakness?
Yeah, sometimes my backpack feels like it's way too much weight to bear. Especially when I'm already drowsy during the day.
Have you noticed any abnormal hair loss?
Well, my hairbrush is always full, and I just recently had to clean out my shower drain because there was so much hair in it. But I just assumed it was due to stress and midterms coming up. Is that bad?
Okay, no, that's fine, but I'll make a note of your concerns for your doctor to go over with you when he comes in. In the meantime, I could give you some of my best advice on how to get a better night's sleep if you'd like.
Yes, please. I'll take all the advice I can get.
Okay, well first I would suggest establishing a regular bedtime and wake-up time for all days of the week to enhance your circadian rhythm. See if you can go to bed earlier than 2 in the morning and really strive to get a full 8 hours of sleep.
Alright, it'll be difficult to break my habit of staying up late, but I suppose it's for the best. I'll give it a try.
Okay, next it may help you to fall asleep faster if you refrain from drinking caffeine so late in the evening. Instead, try eating an apple so the natural sugars can give you the energy you need without keeping you up at night.
Okay, I like apples, but it's gonna be hard to give up my caffeine habit.
Okay, speaking of habits, it's a good idea to establish a regular, relaxing bedtime routine before sleep, such as reading, listening to soft music, taking a warm bath, or doing some other quiet activity that you enjoy. Also, try to refrain from using your smartphone before bed. The light from the screen can make you feel restless.
That sounds like a good idea. I have plenty of reading for school that'll put me to sleep.
My last piece of advice for you is to create a restful environment for sleep. Minimal noise, a comfortable room temperature, and appropriate ventilation and lighting is best for relaxation and sleep promotion.
Alright, I'll have to talk to my roommate to help me set up a relaxing environment in her room. I'm sure she could benefit from all of this too because she sleeps less than I do.
Great. So to conclude our meeting today, I'd like to go over some of the things we've talked about. But first, do you have any questions for me?
I don't think so. You covered the majority of my problems.
Okay. Then I will print you a copy of the sleeping tips I discussed with you, and Dr. Beaumont will be in shortly to see you. I hope you have a wonderful rest of your day and you'll be getting a good night's sleep very soon.
Thank you very much.
It was very nice to meet you and good luck on the rest of the semester.
Thanks.